actually work in a prescription drug overdose program right now. So yeah, let's just dive right in. Okay, so the problem. First, obviously, and maybe you guys have heard, maybe you haven't, but are seen on the news, on billboards and whatnot, but we have a problem here in Utah and here in the United States with opioids. Just to kind of give you some perspective here. So with this state, we rank 7th in the nation for prescription, or for, opioid overdose deaths. We used to be ranked 4th. So that 7th, that doesn't mean that we are doing better. It's just because other states are actually doing worse, unfortunately. The district, here in Bear River, the Bear River Health District, we are actually ranked 6th in the state for opioid overdose deaths. And then in the county, Fox Elder County is ranked 11th in the state for opioid overdose deaths. And then here, just even narrowing it down even more, in Brigham City, we are actually ranked 15th in the state for opioid overdose deaths. So just to kind of give you an idea of what an opioid is, in the simplest of terms, an opioid is just a class of drug that's used to reduce pain. There's several opioids out there. Right here you can see the list of prescription opioids. I just want to show you this list so that you're aware if you're prescribed one of these, if your family members prescribed one of these, you can ask some questions. I'll go over that in just a second. But just a few probably that stand out to you, you've probably heard before, probably Lortab is a pretty common name. The codeine, Tylenol 3, oxycodone. We have Demerol, Suboxone. So a lot of these I'm sure you have heard of. They're pretty common, commonly prescribed. Vicodin is another common one. Percocet. Okay, so who is at risk? Basically, unfortunately, anyone is at risk for this. Opioid addiction, it can happen to anyone. It can happen to your grandma, it can happen to your mom, it can happen to brother, sister, CEO. It can happen to anyone. And something to know is that with opioids, physical dependence can happen in just 7 days. Okay, that doesn't mean addiction, but the physical dependence can happen in just 7 days. So that can potentially lead to an opioid addiction. And with this, I feel like you see on the news, we see, at least for me, I present this, I research this, and I feel like we can sometimes get lost in the statistics, and we kind of forget that these are real people, real families that are devastated by this epidemic, if you will. So just to kind of give you a little perspective, so first, we'll start broad. So a tiny Kentucky county of 12,000 people, a 53-year-old mother, 35-year-old son, and 7 others died of overdosing on pain medication. Narrowing it down to even here in Utah, a 13-year-old girl here in Utah fatally overdosed on oxycodone pills taken from a friend's grandmother. So another story, another person that's been affected by this, a 19-year-old from Sandy, Utah, died after his abuse of prescription opioids combined with a heroin addiction. So this, just kind of show that these are real people. This is just not just statistics, and we want to do something about this. So this portion, it's going to be more focused on prevention. What can we do to, number one, prevent even opioid addiction, and what can we do to kind of help combat this problem? Okay, so number one thing that we can do is speak out. So being your own health advocate, talking to your doctor if you're prescribed an opioid, talking to your doctor and saying, hey, asking these 5 questions. So number 1, okay, am I at risk for addiction here? Okay. Number 2, okay, will something else work other than an opioid? Is there something else that could be better for this situation? Number 3, how long will I be taking them? Okay. 4, are you prescribing the lowest dose possible? And then 5, what's the plan here? What's the plan to taper me off of these medications? Those are the 5 questions you want to ask if prescribed an opioid. Like I said, be your own health advocate. And again, if you have any questions or comments, please chime in. I welcome it. Okay, so opt out. This is the second thing we can do. Sometimes, like I said, sometimes opioids, well, I don't know if I said this yet. Opioids, they sometimes aren't the best for the situation. Something else could be better. Something else could work better. So with this, most Utahns struggling with opioid addiction, they receive their first opioid prescription to treat short-term or acute injury or surgery. So most of the time, basically the opioids, that's what they were made for. That's what they're meant for, is to treat short-term acute pain, or excuse me, not acute, sorry, opposite, kind of going. Opioids are actually, opioids are made for chronic pain and end-of-life treatment, not necessarily the acute injuries or right after surgery. It's more for long-term and end-of-life. Just a kind of interesting fact here. So Utah needs a breakup. We need a breakup with the opioids. So there are 7,000 opioid prescriptions filled here in Utah every day. That's quite a bit. I don't know if you went and saw the Bear River Valley Hospital, that big pill bottle chandelier that was out there. That has 7,000 pills on it, and that just represented how many pills are filled here in Utah. Okay, so the next thing is to opt out. With this, like I said, other interventions could work better than opioids. Talk to your doctor with that other question. Will something else work? What can work? What's the best for my situation here? So sometimes a combination of acetaminophen and ibuprofen works great. Maybe a leave works great too. It could be physical therapy. Physical therapy is a great intervention. Exercise is another one. Certain medications that treat depression or seizures, those have some qualities that could possibly help. Interventional therapies, so injections, certain types of injections, even some types of creams work better. And the last thing is cognitive behavioral therapy is another great option. Like I said, more common, it's the acetaminophen and ibuprofen combination for the short-term injuries and after surgery that work. Honestly, that work the best. Yeah, go ahead.
Is there anything going on like on the medical side that's trying to get doctors to quit taking opiates, like first option?
First option. Yes, that's a great question. Yes, the state. We're working on that. The state is working on that. We actually just did a prescriber training a couple weeks ago with nurse practitioners and physician assistants, just to kind of target that, to reduce the number of prescriptions that are being prescribed, opioids that are being prescribed. So we're working on that, and it's in the works. So yeah, but it's a good point. Actually, here in Box Elder County, we have the highest prescribing rate. So we're definitely trying to get something done about this. And that's the thing, you know, at the very beginning, there was a big push to push these opioids, push them. They'd get incentives for prescribing opioids and stuff. And so now we're seeing the effects of it now and pushing for pulling back on that. That's great. Thank you. Yeah.
I know people with, even with a history of addiction in their family, tells the doctor, and the doctor still prescribes.
Yeah.
Why aren't the doctors held more accountable? I mean, it's such an epidemic. It seems like they're not helping with that profession.
No, and that's where the prescriber trainings come in. We're trying to just like almost retrain that brain from what they learned in medical school, what they learned from the pharmaceutical companies and everything. And that's what we're trying to do, is trying to just kind of switch gears, switch their idea on that and say, hey, that's probably not the best. You know, other things can work better. Yeah, it's a good question. And that's where, again, and I want to say this, that's where you need to be your own health advocate with that too.
Well, that's what I was saying.
Oh, okay.
If you tell the doctor still prescribes it.
Yeah.
So, I don't know.
What?
Just asking for other alternatives.
Oh, yeah, just asking. Yeah, and yeah, thanks, Lena, for bringing that up. So, yeah, just asking, even though they're like still prescribing, and say, hey, is there any other alternative that would work better? I really prefer not to take these medications. They should listen to you. I mean, they should listen, and it's a hard situation. It is. Yeah.
You can kind of research things yourself also,
Yeah.
I think, and see if there's an alternative out there. And just because a doctor prescribes something, we do not have to do it.
Right. That's a good point. Thank you. Yeah, that's a great point. I didn't think about that. Exactly. So, I mean, if he does prescribe that to you, again, thank you. You don't have to go pick that up. That's true. But if someone who's addicted, and they probably might pick that up. And,
They're going to pick it up from no matter where they go,
Oh, yeah.
whether it's on the street or wherever.
yeah,
Unfortunately.
unfortunately, yeah. Yeah, that's a tough one. But we're working on it. We're trying. Okay, so the next thing is to throw out. So about 74% of Utahns currently addicted to opioids. They got them from a friend or family member. Whether it be that they were just given it, mom helps out their daughter or whoever. They have a sprain their ankle. Oh, I have some extra opioids for my surgery. I can give ya. Okay. Or the number two, keeping unused medications in your home can increase the risk for theft. So the 74% either got them from stealing from a family member or friend, or they could have gotten them from just been given to them. Proper disposal of opioid medications, it lessens the chance that someone will become addicted, and obviously reduces the impact of the environment. So definitely we want to encourage you to properly dispose of your medications. That means putting them into a drop box or using a neutralizer bag, and I'll kind of go over that in just a sec, but definitely flushing toilets or flushing medications, especially, any medications down the drain or down the toilet, putting them down the drain, putting them in the trash. All those things are really bad for our groundwater, for our fish, for our environment. So we really discourage from just doing those things. Another thing, especially with the trash, throwing away your medications there. A pet, an animal could get into that, eat it. A child could get into it, take some. So there's just a lot of risks with that. So next is right here, yeah. So dispose at a drop box or usually using a neutralizer bag. And these are what the neutralizer bags look like. Not all of them are look the same, but this one on the top, this one's really great. It's kind of a bigger bag, so you can fit more pills, more medications in it. All you do is just put in I think it holds about 40 pills. Put your pills in there. Put some water in there, the amount that it says, shake it, and then throw it in the trash. Yes.
So where do you get the bags? Are they free? Do you have to buy them?
So we were giving them out a little while ago. We're hoping to get some more, and so that we can give some out. Or you can just go online and search like prescription neutralizer bag, and there should be quite a bit there. I think the one on the top is unfortunately it's about $20, I think, so it's a little pricey. The one on the bottom, though, this one, they said that you can find at Walmart, either online. If you can't find it in the store, you could probably find it online. But it's called Dispose RX. This one is a little cheaper than the other one. Basically, though, this one, it's smaller, so it won't neutralize a whole lot of pills as much as the top one. Just you take your pill bottle, and then you just dump it. It's like almost like a sugar packet. You just dump it into your pill bottle, add some water, shake it too, and then you throw it away. So it's not going to hold as many pills, but it still gets the job done. This is awesome for people who can't get out of their house very much, have difficulties doing that, so it's awesome for that. It's also great just to have, it's very convenient also. Okay, so with this, a lot of it says opioids right here, and we're kind of focusing on opioids, but with this it can apply to opioids, it can apply to even other medications that you have. So we're going to talk a little about safe use with medications. First is only take opioids or only take medications that are prescribed to you. Don't be taking anyone else's. You don't know if you have the pills that you're taking now, medications you're taking now, if they'll have a bad interaction with whatever pill you're taking. Next is never share your prescription opioids. Never share your medications. Next is never take your opioids more often or in higher doses than prescribed. Same with medications. Ask your doctor about drug interactions. And this is especially true. I mean, it can be with all medications, making sure you're asking your doctor. That's a very important question. Hey, what are some drug interactions that I need to know about with this drug, with this medication? But especially with opioids, it's kind of a dangerous thing. Even some over-the-counter medications with opioids can be deadly. Cold medicines, cough medicines, those kind of things, it can potentially cause an overdose. Another thing is other medications such as like benzodiazepines, which are the anti-anxiety medications. Those are depressants. An opioid is a depressant, so that could potentially cause an overdose as well. Know the risks, know the side effects, all these things associated with opioids, associated with your medication. Don't change your dosage on your own. Always, if you feel like you want to take less, call your doctor. If you feel like you need to take more, talk to your doctor. Never make that decision on your own, okay? That should be consulted with your doctor first. And then next, the same thing I talked about before, just properly disposing of all unused or expired medications. Getting those out of the house. Like I mentioned earlier with the 13-year-old who took some or got some of the opioids from her friend's grandma. It doesn't say how she got them, if it was the grandma said, here you go, we don't know. I'm assuming that she probably stole them. Those probably used her grandma's medications, and her friend and her just stole them. So that's why we want to get rid of those. So with safe storage, number one, so store opioids out of reach of kids, family, guests, pets even. I think, forget about the pets. Preferably in a locked place, such as like a med safe. I don't know if any of you have heard of or seen of a med safe before. It's just like a box that you can lock and put your medications in. That's probably the best, especially with opioids. Those are dangerous medications, and we definitely want to keep those out of reach. A lot of people keep their medications in their kitchen or in their bathroom. Those are very easy places for someone, a guest or family member, go to the bathroom, go through your medications, take some. So yeah, we definitely, that happens. That very much happens. So know where your opioids are at all times. Like I said, it's a dangerous drug, so we definitely want to make sure you know where they are. Keeping track of how many pills you have left. That's another thing, making sure no one's stealing them. Leftover opioids can tempt some teens to try them and experiment with them, to get high, whatever it may be. That's another reason why we store them in a safe, secure place. Keep opioids in the original container with the label attached and child-resistant caps secured. Why would we just want to keep it in the label? In the container it was originally in. It's a pretty easy answer.
Has the dosage and what it is, and I
Yeah.
realize it, gives you the dosage, gives you the expiration date, gives you.
All the information. Yeah, exactly. All the stuff that you need to know. Exactly. Has all the information you need to know. It makes sure that you, if you're putting it with other medications, so at the very bottom, do not combine medications to one bottle. You may not know forget which one is which. It's just safer to just go about that way. Store opioids as directed. Again, I think most people store their their medications in like the bathroom or the kitchen or something like that. That could be not the best place. Like I said, people could steal from you from there. But also, you need to keep your medications in a cool and dry place. And obviously, the bathroom gets hot and humid, and the kitchen could also get hot and humid. And so that's why we want to keep them out of those areas. Okay, so this next section, it's more on harm reduction. We want to make sure that you're helping, you know what to do in an overdose situation if someone overdoses. So first we'll talk about naloxone. Naloxone is it's a great drug. It reverses an opioid overdose. It blocks the effects of opioids in the body, and it's very safe. The same dose is safe for a baby as it is for a 200-pound man. I could take it right now, and it just wouldn't do anything to me. So it's very safe, and it's non-addictive as well. So there's several types of naloxone. There's the intramuscular, which is this very far left one, the Evzio, Narcan nasal spray, and the other nasal spray. The two end ones, those are the more generic brand ones, and so they're going to be cheaper. The ones in the middle are the brand ones, and they're going to be obviously a little more expensive. So some common risk factors to be aware of. This is, if you have friends, family members who, whoever, these are some of the things that you're going to look for and that will potentially cause them to have an overdose. So number one is change in tolerance. So basically tolerance is just a state in which the organism no longer responds to the drug. So with that tolerance, someone starts using, and then they build that tolerance, so they'll keep using, increasing the dose. What's scary about this with abstinence is that the person could be had a period of sporadic use, been incarcerated, went to a detox program, whatever. They haven't been using for a while, and they go and use that same high amount that they were before they stopped. That's very, very dangerous. That's very dangerous, and that could potentially cause an overdose. Another thing with mixing substances is another risk factor. So opioids, like I said, are depressants, so they slow down the central nervous system. They're going to slow down the breathing as well. So with that, mixing substances includes the benzodiazepines, the anti-anxiety medications. It also includes alcohol, because alcohol is a depressant. Mixing includes the cocaine, meth, those kind of things, the stimulants. Some people think that taking a stimulant, an depressant, it'll like level it off. With that, that's very dangerous. The more drugs you put in your body, obviously it's the more taxing on your body. Injecting is another one. If someone goes from orally taking to snorting to injecting, just the different route of that is a risk factor. Using alone. So with this, I want to say, well, using alone, if they overdose, who's there to help them? No one. No one's there, so no one can bring them back. You know, with all of these things, in your mind, you might be picturing a certain person. This person could also be your mother, your grandmother, your son, your daughter, whoever. Like I said, this can happen to anyone. And so this is why, especially with the older senior population, they forget how much they took, and they take more. That's pretty common too. And so I want you to kind of just remember that in the back of your head. Physical health is another one. So if someone has pre-existing conditions, especially respiratory issues like COPD, asthma, those kind of things, that's another risk factor. Another one is mental health. With this, we worry about self-medication. We worry about mixing other substances. And we also worry about suicidal ideation with this. Okay, going into the overdose response, first we'll assess the person. Next, call 911. Perform rescue breathing, administer naloxone, and monitor and support that person. So the things you need to look for in an overdose situation. Basically, in an opioid overdose, if the person is unresponsive to any stimuli, especially that sternal rub, if they have bluish coloration to them, bluish fingertips, bluish lips, that's another one. Pinpoint pupils, very small pupils, like a fleck of pepper, small. That's another telltale sign. Another sign that is kind of sad is the deep snorting. I want to mention this. A lot of people have said, oh, I thought my son or whoever was just taking a nap. They were just snoring. If it's the deep snoring, it's a snore that you haven't really ever heard before. It's kind of different. That's actually a death rattle. And so definitely try to listen, try to be aware of that. The situation could have been different with that. Step 2, call 911. Just answer the questions to the best of your ability. Put it on speakerphone so that you can be doing other things. Stay with that person, obviously, until help arrives. And some other reasons why we call 911. Number one, it might not be an overdose. You don't know for sure. It could be something else, heart attack, diabetic coma. Another thing is naloxone. It only lasts for about 30 to 90 minutes. Okay? So if that person was in a real high, you give them naloxone, you give them naloxone, and then within 35 minutes, and they were in a real high, they could slip right back into an overdose. Some people have had to have like multiple 6 doses of naloxone, plus going to the hospital and being on a Narcan or naloxone drip. I mean, it's very serious. So basically, naloxone just gives you enough time to get the professional help that they need. Another reason why we call 911 is because that person could be combative when they come out of their overdose. You just took away their high. They will probably be angry. And not only that, but they're going to withdraw symptoms immediately. So they're not very happy. So we definitely want some help there. Okay, so step 3, perform the rescue breathing. Very simple, this one. It's not chest compressions, it's not CPR, you're just giving rescue breaths, you're just getting some air into them. The steps for that, so you're going to lay the person on their back, tilt the chin, so you're going to open the airway, check the airway, remove anything that may be in there, look, listen, feel, watch the chest rise and fall, listen to hear them breathing, and then feel if you can see if you can feel their breath on your cheek. Next, pinch the nose so it closes completely. Cover mouth so it closes completely. Blow 2 regular breaths that are 1 second each, and then breathe again. Make sure you're getting some good breaths, and continue 1 second with 1 breath every 6 seconds after that. Something I do want to note that if something is indistinguishable on their face or it's blood, really try to get a face mask. We definitely don't want to spread any disease. We don't want, if it's fentanyl, that's very dangerous because if you are breathing and you get in contact with that, you could go into an overdose immediately. So we don't want to put you at risk either. So step 4 is administer naloxone. Like I said, there's the 4 different types. The Narcan nasal spray, there's 2 doses in 1 kit. All you'll do is just open it up, put the Narcan in the nose, and then push the plunger spray. With the Narcan, you don't need to prime it. If you prime it, you lose your dose. It's gone. The intramuscular is the next one. With this one, the dose, they say to take up 1 cc of the naloxone. Really, it's the whole vial. 1 vial is 1 dose, okay? So in that situation, you would take the vial, take the needle, put the vial upside down, stick the needle in the plunger, and then just pull back. Don't worry about bubbles, because it's going to a muscle. And then you're just going to stick it into a large muscle. So your arms, your upper arms, your thighs, your bum. Those are some of the large muscles to put it in. And then there's the Ebzio. So the Ebzio is really great. It walks you through it just like an AED does. It talks you through it. But I want to kind of get some, how much do you think this is? Throw out some numbers for me. Yeah, for the Ebzio. Yeah, for the AE, like the talking through.
$30.
Okay, go up.
100.
Go up. Go up. Go up. It's about 3,000, 2,000 or 3,000. Isn't that crazy? Don't know why. Doctors don't know why either. It's why it's that much money, just because it can. Just because it talks to you, just because it can. I just like to do that because I think it's just kind of crazy. It's that much money, so I just like to see everyone's reaction. So the Narcan Assemble Spray, this one I don't talk a lot about just because most pharmacies don't really even have this one in stock. Most people don't really have this one. I think it's not very user-friendly. So I wouldn't advise getting this one if you can. If it's the only one you can get, totally get it, but it's probably not the easiest. And it's step by step. If you do get that one, just read the instructions and it'll be good. Okay. So step 5, monitor and support that person. So staying with them after you've administered naloxone, you're going to put them into the recovery position. another not side effect, but what happens with if someone's been administered naloxone, they go, like I said, they go into withdrawal symptoms immediately, which can cause some symptoms such as agitation, upset, nervousness, shakiness, and also nausea and vomiting. I've heard a lot of stories where the vomiting, people have vomited. So that's why we want to put them in the recovery position so they don't aspirate. Basically, with the recovery position, all you'll do is take, let's say you're right here on this side of me. You're going to take my arm, put it up, take my other arm, put it all the way across to my chest and up right here. You're going to take my leg the furthest away from you, up, and then you're just going to roll me over. So I'm going to be, my head's going to be able to rest on this position. Okay, so with price. The price, the cost, it varies. It depends on insurance. If you do have insurance, it could be anywhere from $0 to $30. If you don't have insurance, it could be anywhere from $30 to $200. Something to note, though, is that insurances, naloxone is kind of a new thing coming out, and so, sorry, like, what's going on? I'm not used to it. And so, with that, a lot of insurances are not covering naloxone quite yet. Some do, so always check, but it's kind of working towards that. I do want to note, though, that right here, you can go to utahnaloxone.org. If you need to write that down, I'll stay on this slide for a second. But utahnaloxone.org, you can get free naloxone. Yes.
At what point, I mean, should everybody have that in their house, or
Mm-hmm.
talk about it, like that everybody has it on hand?
Yeah, that would be awesome if I was like, that would be amazing if everyone could have it. I think that would be great.
Or is it just if you have a prescription for an opioid, if you know someone who has an addiction?
Especially, I would say especially, I mean, obviously, it's hard for everyone to have one. It's probably, not the easiest for that. But especially if you know someone who has an addiction.
I mean, most of us don't have that on hand at our house.
Right, and I'm sure, I don't either, at my house. I probably should, I feel like. But definitely, if someone has, someone who has an addiction, has an issue with that, or, is struggling with that, I should say more, that would be great to have that on hand. Yeah.
Megan, do you have to have a prescription to get it from your doctor, or you just go to this free website?
So with that, you actually do not need a prescription. You don't need a prescription. That's why with this, the doctor, she's a doctor. Well, okay, yeah. So she's a doctor who started this program, started this whole naloxone program. And so since she's a doctor, she can just give out, you don't need a prescription, so she can just give out for free. When she comes and does presentations, she actually did one at the Bear River Health Department in Tremont a few months ago. And every time she does a presentation, she brings a box of her kits and she says, please take one. So with that, I'll actually go more into that in detail in just a second. But yeah, that's why you don't need a prescription. That's why she's giving these out like that. She's able to do that. And something else to note is that here with the Bear River Health Department, we have been given some kits, some Narcan kits to give out to the community, to have available for the community. And so it's only a limited number, so once it's gone, it's gone. But we do have that available, and so if you feel you need that, or you know someone who you're worried about, come to the health department. We can do that for you. You've already received the training. That's a part of it. To receive a naloxone kit, you have to have the training. You've received it, so that's good. But yeah, we have that available for a limited time. Okay, so the laws. There's the Overdose Good Samaritan Law, It allows a bystander to report an overdose without fear of criminal prosecution for illegal possession of a controlled substance or illicit drug, and it protects the administrator. So with this, if you administer naloxone and they're mad at you and whatever, you won't get sued. You're protected. It's the Good Samaritan. It's with that Good Samaritan law. Also, with the second one, Utah Naloxone Access Law, it says it authorizes a third party, so friends, family members, someone you may be worried about, those prescribing and dispensing of naloxone. And again, it protects the administrator. And then the third one is the Utah Naloxone Standing Order. With that, it allows pharmacists to distribute naloxone to a third party without a prescription. And this law kind of overshadows the other law. This law came after, and so it kind of replaced that law a little bit. So if the pharmacy is enrolled in the standing order, then you can go to the pharmacy and just say, hey, I would like a prescription of naloxone. And they would say, okay, here you go. You don't need a prescription for your doctor. You don't need to call your doctor or anything like that. It's just almost like a flu shot. Just go up and say, hey, I'd like some naloxone. Any questions with that? Okay, good. I do also want to mention that we have at the health department for a limited time as well. Is that correct, Alina?
It is, but for now it's ample supply, I believe.
Ample supply.
Yeah.
For now, yeah.
It's all grant funded, so you know how that goes.
Yeah, exactly. So currently, right now, we are offering MAT, medication-assisted therapy. Basically, with MAT, MAT is the use of medication prescribed by an on-site physician to assist in the managing of addiction at low or no cost. MAT is most successful when paired with the behavioral counseling, which is also provided at the Bearver Health Department, and that's part of the MAT. If you know someone who is struggling with addiction, opioid addiction, this could be a really great thing for them. And that's the thing, they have to have the counseling with it. That's where they've seen have it be the most effective. We've seen a lot of good stories come from success. Yeah. So, if you have more questions about that, you can call Bearver Health Department, the Substance Abuse Division, or nursing staff, and they're pros. They know this. So some resources for you. So we have prescription drop box locations here. There's actually one missing on there, and I have it on the back of this pamphlet or brochure. So there's the Brigham City Police Department, the Tremont Police Department, and then there's also the Brigham City Community Pharmacy has a drop box. Some other resources that we have the Mental Health Resources Directory. Super great resource. It's awesome. It has all of their therapists, treatment centers in the Box Elder, Cache, and Rich County. Really great resource. Unfortunately, right now our website is under construction, and so once that is up and going, the Mental Health Resources Directory will be on there. And the next one is Substance Abuse Division. We have amazing counselors who work with those who are struggling with substance abuse or not struggling with substance abuse, with any other issue. We have great counselors. Okay, so any questions, comments? Yeah.
Is the behavior counseling ever prescribed in conjunction with the medication? So if a patient really needs the medication, do they ever kind of address the behavioral problems with addiction in conjunction with the use of the medication?
The medication-assisted therapy,
Rather
that one?
than just like a retroactive, oh, now that you're addicted, we need to talk about this.
No, it's like it's full on.
Yeah, we have
Yeah.
have counseling available, someone with a substance use issue or not, so just mental health counseling in general. So we have that available at any time. We actually work with people on a sliding PCL as well, so it's quite affordable. Most of the time you go to a counselor, it's $90 plus an hour, and ours is like 30, something like that. And then the medication-assisted therapy specifically, it does require both of those things. So they meet with the physician, they make sure they are appropriate and fit the criteria for that. And then if that's the case, and medically they're sound and go forward with that, they would meet with the doctor on a regular basis, they get an injection, and then they also do, it is required that they do that therapy as well, so that they're working through that whole situation.
Yeah.
But they have seen a lot of success. We've got a lot of great things that are coming out of that. People are really responding very well. So
Yeah, it's amazing. Yeah.
opioids are difficult, and so that's one thing that we're really excited about to help community members.
Oh, for sure. And something to know with that is to be able to do the medications, they have to be sober, so haven't been using for, I think, 10 or 7 to 10 days. For a period amount of time, they can't use. That's something to kind of
So
know.
it's perfect, like if someone's gone into a detox situation, or
Yeah.
they've been incarcerated, or they've been, the doctor's been working with them maybe even prior, and so our counselors can kind of help get them ready for that as well. So if they need some assistance to kind of get through until they're at a point where when they're given that medication, it can be effective.
Yeah, great question. Anyone else have any questions, concerns? Okay, well, great. Thank you guys for letting me come and take some of your time. I appreciate it. And I did this the last one, just keep forgetting all my brochures. So I'm going to go ahead and pass these out. Try to see the best way to do this. Yeah, maybe. So I'll just give these to each of you. The first one is throwing out, making sure you dispose of your medications properly in the drop box location. Oh, sorry. This one is the MAT, medication-assisted therapy. More information on that. And then she's going around with the naloxone pamphlet, and that just has all the information that I kind of talked about today with that, and the steps of what to do in an overdose situation as well. And then the other one is just on prescription drug safety. Oh, did you get? Oh. There you go. Yeah, there you go. Let me come and take some of your time, and you'll have a great week. If you have any, if you do have any other questions.